Hello, everyone. Thank you so much for joining us tonight for our D211 Virtual Career Expo. My name is Mrs. Waterman, and I'm the Career Advisor for Hoffman Estates High School. Also here with me tonight is Mr. J.C. Brown, the Student Services Department Chair for Hoffman Estates High School. We will be moderating this evening's session.
Yep, thanks, Paula. The Student Services Department has multiple staff members to assist your student with their career exploration. Our school counselors will guide your student with information specific to their individual career path. School counselors also present career exploration lessons to all grade levels throughout the year. We also have a college and career counselor who supports students with more specific information related to career exploration. Lastly, our career advisor, Mrs. Waterman, she provides information related to internships, job opportunities, career assistance, and even provides field trips to different workplaces in our area. Thanks for coming.
Before we get started, if everyone from home could please click on the attendance link that we're going to be dropping in the chat bar. I'm sure students are familiar with how Zoom works. This will take you to a quick survey so we know who is joining us tonight, and that will help us reach out to you and get any of your questions answered if you have any throughout this evening. My JC is kind enough to drop it in the chat bar for us. So today we will be talking about careers in healthcare and in health science. Health science workers promote health and wellness. They diagnose and treat injuries and disease. Many careers in health science have you interacting directly with patients, but you could also work in a laboratory to get information used in research or provide administrative support for keeping medical records. Health science jobs are found at a variety of different sites. For example, you could work in a hospital, office, clinic, or nursing home. These positions can also be found in unexpected places like cruise ships, sports arenas, and schools. We have a wonderful group of speakers tonight that will be discussing their careers in health science. During the presentations, if you have any questions that you would like to ask, please drop them in the Q&A tab at any time. If we do not answer your question during our live session, we will work with our speakers to get you the answers after the event. So our speakers tonight are from Alexian Brothers Women and Children's Hospital, Ms. Mary Kate Dvorak, who is a certified child life specialist, and her students, Amy Kelly and Rachel Malaeski. I'm sorry if I messed that up. We also have Dr. Caitlin Mchugh, who's an optometrist, Dr. Susan Scanlon, who is the president and physician of the Midwest Center for Women's Healthcare. And we may be having River Tuison, a occupational therapist, joining us later. So thank you so much for joining us tonight. Without any further delay, I'd like to introduce our first speaker, Ms. Mary Kate Dvorak and her students, Amy Kelly and Rachel.
Hi there. Hi guys, welcome. Thank you so much for that intro. We are excited to be here. Like Ms. Waterman said, I'm Mary Kate. I'm one of the child life specialists here in the hospital. My students here are going to present mostly, so I'll let them introduce themselves. But we're excited to be here.
Yes, so I'm Amy, and like Mary Kate said, I'm a child life student, and so we're not quite there yet as child life specialists, but we're learning from the best right now. So we're learning how to become child life specialists. But for those of you who don't know, a child life specialist, they work in children's hospitals or hospitals that have children population, and we're not nurses or doctors. We're more of experts in child development, and our job is to provide this comfortable environment for children and help them deal with the stressors through play and understandable language. It can go from anything through teaching to diversion. We use a lot of different tactics to kind of make the experience best for each patient individually. Going along with that, there's a lot of traits and skills that go with being a child life specialist. Personally, I feel like a child life specialist is someone who has to be able to work with a lot of different people. You're working with people from so many different ranges of professions, and you learn every day. So being open to different backgrounds is super important, and being super adaptable and flexible, I think, is also a trait. You know, you have to work on the fly and think of how you can help each patient individually. And as we know, each patient is different. So being creative and coming up with new ways and tactics is really important. And lastly, just loving to be around kids and families. That's the best part of why we work. So just having that passion, that's what drives me to learn from Mary Kate and her coworkers every day.
Thank you, Amy. I'm Rachel. I'm another student here with Mary Kate and Amy. So day to day, our days are always looking very different. As I'm sure you guys know, a lot can go unplanned in a hospital environment. But we attend rounds every morning with the medical team and the psychosocial team. We do assessments and interventions with patients and families. Our main goal is to help kids cope in the hospital, like Amy said, and to also provide that normalcy too. We do a lot of preparation, and we also do preparation for different procedures, such as like an IV to surgery. And then we also do procedural support, being there during an IV placement or PICC line placement to help the child and their family cope through it and understand what's happening. And we do this in a lot of different ways. It looks different with every kid, but we have different tools. And we're doing teaching, such as like, this is our MRI teaching tool. We also are big advocates for pain management. So we have one of our tools here today, Buzzy. Buzzy, as I tell the kids, plays a little trick on your brain, and it provides some vibration. And it does a little trick on your brain. So you put it in between the pain and the brain to help minimize that poke or injection. And lastly, to be on this path, there's a lot of different ways to navigate it and go about it, but having that background in child development is crucial. Psychology, health sciences, which is something I did, and volunteering hours, as well as practicums, which are kind of our clinicals, and our internship. Those are really those big highlighted components needed to get certified.
Yeah, and to wrap that up, you know, these students are doing a 600-hour internship, which is like a semester of school. So they're with us from, you know, January to April. And so they're learning hands-on, where they learned all their coursework and all the skills, and similar to, you know, you guys in school of, you know, learning out of a book and doing your assignments, but then getting to apply it is where the students are at right now. The biggest thing that I can say is, you know, if this is a field that somebody's trying to go into, it's a very competitive field. There's a lot of students who are looking to go into child life, and there's not a lot of child life spots available. You know, we get over 50 applicants for an internship, and we only take 1 or 2. And so it's a really wide range, and, you know, we wish we could give them to all. So I always tell students to, you know, volunteer that's going to stand out. So volunteer in a hospital when you can. Volunteer in camps, or, you know, your school districts, and things that if you want to do this, then those out of the box experiences. Somebody who's looking to be flexible, who's okay with working weekends and evenings and holidays and all the funness that comes out of a hospital setting. It can be really challenging, but I always like to prepare somebody for that, because I think sometimes it sounds like a great profession, but then all the other things that come with it, you know, they weren't prepared for. That's not something they learn in their school. They learn all the fun stuff that we get to do. So just kind of a piece of personal advice I think is really helpful for students looking to go into this career.
Thank you so much for sharing that with us. That is great. For our guests that are watching from home, don't forget that you can submit any questions that you have through our Q&A tab. So at any time, pop those in the Q&A, and we'll get to those if we have time at the end of our discussions. Now we're going to move on to Dr. Caitlin Mchugh. Welcome to the panel, Dr. Mchugh.
Hi, thank you so much for having me. So I'm an optometrist, or an eye doctor, and I am also an owner of our business. So I work in Buffalo Grove. And so basically, what is an optometrist? An optometrist is the primary eye care professional for the eye. We do everything from diagnosing eye health diseases, and also prescribing glasses and contact lenses. And then what was like a daily life of an optometrist? So for my day-to-day is what you might think of an optometrist. Like I said, our bread and butter is really prescribing glasses and contact lenses. And we provide eye care for patients of all ages. I have patients who are as young as 6 months old, patients up to over 100. And the nice thing or interesting thing about being an optometrist that you may not realize, it is a lot more than just the which is better 1 or 2. We also do a lot with the eye health side as well. So we do things like provide primary eye care for emergencies like trauma to the eye or like red eyes, things like that. And we also diagnose and manage specific eye diseases like glaucoma or cataracts. And we are also very important in helping to diagnose systemic eye conditions as well. So that bottom picture I have there is actually a picture of the back of the eye. And this is a literal window into the systemic health of a person. So we are able to see things like diabetic changes very early on or high blood pressure changes early on that we are able to discuss with the patient and help them get further care. And for myself personally, as I mentioned, I'm also the owner of the practice. So I do a lot on the business end as well, managing staff, paying bills. So for myself, I actually went to Schaumburg High School, and then I went to Illinois Wesleyan University, where I received my Bachelor of Science. I had a biology major and a psychology minor. For optometry school, I would say that a science background is helpful, but it is not required. But your class load is very science heavy, so it does help to have that. But I had some classmates who were art majors and then took the required prerequisite classes so that they were able to still attend optometry school. And then I went to the Illinois College of Optometry, which is a 4-year program with an optional 1-year residency. So it's very similar to what dental school is like, if you're familiar with that. And then there's lots of benefits for being an optometrist. You are improving people's lives. You're literally giving them the gift of sight, which is wonderful. It's so great to see, you know, some of my littlest patients not realizing that they couldn't see clearly, being able to see for the first time, all the way to helping someone pass their driver's test. So there's so many different patients that you can help. And you do get to work with patients of all ages, and you can kind of customize that. For instance, when I was working at another office, I was our pediatric doctor. So I was seeing patients only under the age of 18. Now at my own practice, I'm seeing everyone because I'm the only doctor. So I see patients of all ages, but you can kind of tailor that as well. It's very mentally stimulating. Every patient is different and presents a new challenge. As far as hours, optometrists typically work about 40 hours a week. You may have some evening and some weekends. It kind of depends on your mode of practice. Average income is about $115,000, and lots of flexibility. You can have part-time, you can have independent contract work. And this is actually a profession that is great for women. It's actually kind of surprising. I checked the most recent incoming class for the Illinois College of Optometry class of 2021, and it was actually 75% women. So it's definitely a female-friendly profession. There's flexible hours, and it's just a great profession all around. And then some qualities that would make someone a great optometrist, I would say first and foremost in any health science medical profession is to be compassionate. You have to empathize with your patients, you know, treating each patient as a person and being able to understand that. And just being someone who is friendly, inquisitive, detail-oriented, patient, and also a good listener would definitely make someone a great optometrist. And one piece of advice I would give to anyone just interested in the medical field, just in general, you don't necessarily have to know exactly what you want to do right away. So make sure you take time to research and shadow people, ask questions. For myself, I knew I wanted to do something in the medical field, but I wasn't quite sure what I wanted to do. And I decided on optometry in my junior year of college. So I made sure I spoke with different optometrists. I spoke with other medical professionals and shadowed them to kind of get an idea of what I was interested in and settled on optometry. So make sure you reach out. As you know, we mentioned, we're more than happy to answer any questions. So please feel free to email or ask any questions in the chat. And thank you and good luck to all of you.
Thank you so much. It was fantastic. Fantastic. Again, if you have any questions, please drop those in the question and answer bar. Going on to our next presenter, it is Dr. Susan Scanlon. The floor is yours.
Thank you. Thank you for having me tonight. I'm excited to be here. My name is Dr. Susan Scanlon, and I am a board certified gynecologist and robotic surgeon. I've been working for 25 years as a doctor. I love what I do. I hope for each of you that you can find a job that you can say that you love as well after working that many years. a lot of people know what doctors do, but a lot of people don't know specifically, you know, my profession. I work with, my profession is women's health. So all the patients are female. The ages of the patients that I work with, the youngest is around 12. The oldest is, I saw today, someone who's 92. So it's the full age range of women's health. And we take care of patients in an office. We take care of patients in a hospital. The type of visits that you visit with them, it can be for routine checkups. It can also be for any particular problems that they can have with pain or their cycle or PMS, or they can grow tumors or cysts, or that they need surgically removed. They may just need medication, so you prescribe medication. Anything that that patient may need through their health experience from their entire pathway through pregnancy and beyond is something that an OBGYN would take care of. So my career path, I went to high school just like all of you. I grew up in Glen Ellen. I went to high school out at Bennett Academy, and then I went to Boston College out in Boston, loved it. At first, I thought that I would be an attorney, and then I joined some kind of like a debate sort of opportunity, and I was terrible at it. And I would cry when I didn't win the debates. And I realized maybe this isn't for me. Then I thought maybe I'd be a social worker. And then I shadowed and I thought, maybe I like it, but it's not quite what I'm thinking. My father was a doctor, so I was always around the medical field. But my mom was an artist. So I thought, well, maybe I'll be an artist. And so I was a psychology major and I was an art minor. And so I moved to Rome and I was painting, and I thought, okay, I'm going to be an artist. And then one day I really looked at my painting and I realized how bad I was. And I'm like, I cannot make a profession out of this. So I came home. That was then my junior year of college. So it wasn't until that summer that I actually figured out what I wanted to do. And I talked to my dad. He's like, Susan, you've always loved science. You've always been good at it. Why don't you take the MCAT and see if you get in? I had always worked summer jobs doing research. It's just something I always enjoyed. So I had that background, and I took the MCAT, I got in, and then I did a gap year before gap years are popular. I moved out to Cleveland and I worked at Case Western Reserve doing research while I waited to see if I got into medical school. And I did. So I came back to Chicago. I went to Loyola for medical school here in Chicago. And that's where I decided I wanted to go into obstetrics and gynecology. And I went and did a residency out in Los Angeles. So I have moved a lot. So you have to be willing to go to wherever you get in. And then I finished residency and came back here to Chicago. So I certainly did not have a defined pathway. I think that's really an important thing to realize as a young student. I compliment you on participating in these career expos because you're opening your eyes to different opportunities. And you may have thought you were going to be a lawyer or a social worker or an artist, and you end up being a doctor, or vice versa. Maybe you think you're going to be a doctor and you go shadow someone or volunteer at a hospital and you don't like it. And maybe you end up being a musician or an artist or go into business. So have an open mind. Explore, do any opportunity that you have to interact with someone in their job so that you can see, wow, what qualities do they have? Are they similar to mine? Is that something that I find interesting? You know, I have 3 kids, and all 3, like a lot of kids, think that they're going to do something like their parents. So all 3 of my kids thought that they would be doctors. And lo and behold, 2 out of 3, we went on a medical mission. What better way to figure out if you like doing medicine? And at that end of that medical mission, 2 were like, we're out. So now 1 is an attorney, 1 is an accountant, and 1 is going to go to medical school. So it turns out, you know, those experiences are what give you the opportunity to figure out a career path or get insight. So try and expose yourself as much as you can to different opportunities. So in the health field, shadowing a physician or a nurse or certainly an optometrist or a child care specialist, those are all great opportunities to see if that's something that you like. If you can volunteer in a hospital, that's great. If you can go on a medical mission, those are all good opportunities. Personality traits to have to be a physician, you have to be someone who is willing to put in a lot of time learning for a long period of time. So it's 4 years of high school, 4 years of college, 4 years of medical school, 4 years of residency. And then if you want to go on and do a fellowship, it's even more. So you have to be willing to put in the years. Compassion is key. Someone already said that. One thing specific about being a doctor is, like, a lot of people say they want to help somebody. I think it's obviously you want to be someone who wants to help someone, but a lot of jobs you're helping someone. The jobs I mentioned, if you're a social worker, you're helping those people. If you are an attorney, you're helping those people. If you're a musician and you're entertaining people, you're helping those people. Specifically to a doctor, you have to want to help someone who has an injury or an illness, something wrong. So you want to, certainly pregnancies, but that's a form of, there's disease components to that. So you're helping someone specifically with that. So if you don't like helping people who are injured or ill and don't like interacting with patients in that role, then that being a doctor may not be for you. Specifically surgery, I love surgery. I don't do obstetrics. I operate on people. I use a robot to do surgery. I absolutely love it. It's fascinating to do and learn. I embrace technology. I think it's fascinating. But just if you like robots doesn't mean you have to be a doctor. You could be a engineer. You could invent robot, components to that. So there's a lot of avenues in the world of science. If I had to share one bit of advice to a high school student, I think if you want to be a doctor and you think you want to be a doctor, but you're not that good at high school science, I would tell you, that's okay. Keep going. You're young. Your brain isn't fully developed. And I've never used anything as a doctor, what I learned in high school science class. What I do use is the skill of studying. So if you think you want to be a doctor and you're not doing that great in your science class, keep going, get to college, take some science classes. As you get older, you're going to learn how to study. Studying is the key to the whole thing. And so learning that skill will help you succeed in any job that you do, but particularly to be a doctor, you've got to be willing to put in the amount of time it takes to learn how to study. So keep going if you think that this is a profession for you. So I think I'm open to any questions that you have, and you can always contact me or reach out to me at my practice as well. And if you have any questions in the future. So thank you so much for your attention.
Wonderful, thank you. We do have a few minutes for questions, and I did see a question that came in that I think is a great question to pose to each of our panelists today. And that question is, are there things that you wish you knew before pursuing your profession? Can we hear from our friends at Alexian Brothers first?
Great question. I think I said it a little bit, and Dr. Scanlon really, I think, described it even more than what I even said originally is volunteer. I think because you don't know if it, this sounds great, right? Like you get to play with kids, you get to hang out with them, you get to work in a hospital. I have often volunteers. I'm our volunteer supervisor at the hospital child life program. And I have students who come to me after a couple of days or a couple of weeks and are like, I don't want to work with sick kids anymore. This is hard. It's not the avenue I wanted to do. I was the opposite. I wanted to be a teacher my whole life. And it wasn't until I started volunteering that I was like, this is exactly what I want to do for my life. So I think really like being open, like Dr. Scanlon said, and being okay that that's not the avenue you want to do, but there might be something where you work, maybe in a hospital setting, but it's social work or a doctor or a respiratory therapist. So there's so many other things that you can do in the setting or the environment that you want. There's a lot of child life specialists who aren't in hospitals that they do. There's some in schools that help kids cope. There's some just in private practice in other areas. So I think really being open to exploring your options would be really helpful. And I think it's important to know going into that.
Dr. Mchugh, can you tell us about something that surprised you about going into your profession of optometry?
Yeah, of course. So I think one thing that surprised me is how much business side of optometry there is. If you were to ask me, actually most of my optometry career as a student, if you asked me if I would be owning my own business, I said that was the last thing I ever wanted to do. And I was out for about 4.5 years, and then I purchased a practice. So I ended up realizing how much I liked the business side of optometry as well. And I have absolutely no business training. I mean, I have nothing. So I just kind of learned on the fly. So realizing how much there is business side to it as well. I don't think I realized that as much going into it until I was out and practicing. So that's something that I didn't think I would have an affinity for. I ended up really enjoying. If I would have known that going in, maybe I would have taken a little bit more like intro to business classes or something in college, but doing okay learning on the fly.
Nothing like the real world to prepare you for the real world. Dr. Scanlon, what surprised you most about getting into medicine?
I agree completely with Dr. Mchugh. I also own my own practice, and perhaps a business class would have been helpful. But I am so grateful that I own my own practice because I'm able to manage my life. I can make my schedule when I come in, when I don't come in. If I had a child, I have 3 kids at one point when one was really young, needed extra help. So I needed to go 3 days a week, and I did for a couple years, and I was able to do that and have complete job security. So owning my own practice has truly been a blessing. But on the flip side, it is a tremendous amount of work, and it is outside the duties of being a doctor, and really takes a lot of time, but I think completely worth the effort. The other thing I was surprised about is I went into the world of OBGYN because I absolutely loved obstetrics. Delivering a baby, I used to say, if you have to work, you may as well be an obstetrician. It's just really one of the most thrilling experiences. And when I was in college, the sight of a pregnant woman just grossed me out. And so then when I fell in love with delivering a baby when I was in medical school, I was completely surprised. And so then when I became an OBGYN, life changed, and my kids were little, and I did obstetrics for 10 years and loved every minute of it. But then I needed to be home more. It was hard to manage being the mom, the hands-on mom I wanted to be, and being an obstetrician and gone a lot. What surprised me was the ability, and I'm thrilled for, to then focus on gynecology, which is a much more scheduled. You do surgery, you have office visits. It's a very scheduled career. So being able to change that, having a profession that enables you to switch directions of how you're working and take charge of your life, was a surprise to me, and I'm completely grateful for.
Oh, fantastic. I'd like to take this moment to thank all of our speakers for sharing your information with us and for answering these questions today. Let me go to our wrap up right now because our time has come to an end, unfortunately. Give me a second. JC, the floor is yours.
All right, thanks. So yeah, now that you've had the opportunity to explore a few different careers, don't stop there. Continue your exploration and post-high school planning. Take a look at the suggestions listed on the slide here. Career interest surveys can be completed using the Zello app on your student's iPad. Schedule meetings with your student's counselor or the career advisor or any of our other student services staff members and meet with them to talk about career possibilities. Lastly, plan to attend a career trek, research internships, job opportunities, and plan college visits as needed. Thanks.
That's all great information. Thank you, JC. Recordings of this and all of our other sessions will be uploaded and available on our website after this event finishes up. So if you joined late or you are interested in watching another session that is running concurrently, you will be able to watch those videos later. And we will work on answering any questions that we didn't get to that are coming through in the Q&A. So if you have any other questions, submit them now to the Q&A and we will work with the panelists to get those answered later. Once we harvest those answers, we will publish those to our website and you'll be able to look them up when you get some time. I'd like to do one final thank you to all of our panelists today for joining us. We really appreciate your time and your candidness and your willingness to share your experiences with all of our students today in D211. Thank you so much, everyone.